Good morning, everyone. So in this video, we will be covering our IV fluids and IV medications. So intravenous fluids, these are large volume sterile solutions of simple chemicals such as sugars, amino acids, or electrolytes used in the preparation and administration of parenteral products. Why do we need to use IV products or IV formulations? We can give them through other routes of administration. It's primarily because we have various advantages and disadvantages of various routes of administration. So the most common you will encounter is oral. Oral medications are very convenient in taking and monitoring. However, they're a little bit slower when compared to our IV medications. So if you experience going to the hospital or getting hospitalized, you will always get uh, administered drugs through IV line. Since IV or intravenous preparations has the advantage of skipping the absorption phase in pharmacokinetics, basically it lets the drug act immediately in most conditions. Also, it's very convenient when dosing since we don't have to wake the patient when we're going to administer our drug, and we can give several parenterals and several ways or several products in a single IV line. Okay, so here are the uses of our IV fluids. They can serve as vehicles in IV admixtures. They can also provide a means to reconstitute sterile powders. They also serve as the basis of correcting body fluids and electrolyte disturbances, such as in conditions of hyponatremia, hypokalemia, acidosis, alkalosis, and other ion disturbances. Also, it's a way of administering parenteral nutrition. So here are the different methods of administering our IV fluids and medication. First, we have our IV bolus and IV push. This is one of the fastest way to administer a drug product. So in this case, you get a syringe and directly push the amount of drug into the IV line. Usually, there is a port in the IV tubing where you can insert the drug and let it be pushed by the IV line water or the IV solution inside the line. Okay. It's called IV bolus when or IV push. IV push meaning you can get a IV line to push the liquid or the drug to the veins. IV bolus could also be a direct injection in your veins without any IV lines present. So syringe to veins, it could be that. So the main purpose of giving IV bolus and IV push is that this method is used to achieve an immediate effect. Next is the continuous IV or drip infusion. In this method, you're going to give a large amount of or a large volume of fluid that is hang near the patient's bedside, and you're gonna allow the fluid to drip slowly using gravity to the tubing and into our patient. This is a slow primary line infusion of an IV preparation, primarily to maintain a therapeutic drug level. So this is used to maintain a specific level of concentration of drug inside the body. We don't want it to be so slow that we can't reach the appropriate therapeutic levels, and we don't want it so fast that it becomes toxic. So this is primarily to have a granular control over the plasma level concentration of the drug. Next is intermittent IV infusion. This allows drugs to be administered at specific intervals. Three different techniques may be used. So in intermittent IV infusion, it's similar to IV infusion. However, there are breaks or a period of time in which you're not infusing the drug. So it's similar to IV bolus, in which you're going to give it at one time, but in this case, you're going to give it over a smaller period of time compared to IV infusion. So here you have your IV piggyback. So for your IV piggyback, you have two IV bags. One is a primary line, and second is the piggyback. So The primary line will have a part in it where you can insert the piggyback set. So basically, it's called a piggyback because you're simply adding another bag to the primary line. Next is additive infusion set. So this uses a volume control device designed to administer small amounts of liquid over a specific period of time. And you could also use a heparin lock or a heparin well system in any case that you don't have an IV line directly attached to your body. So in cases of we are limiting fluid intake, we could use a heparin lock or a heparin well system. So the heparin lock system is basically a very short tube with a syringe or a needle towards your veins. So it could function without any IV lines attached to it. And for in use of intravenous infusion, you can directly attach it to the heparin lock, drain your solution, then seal the lock again. So here are our IV fluids that are commonly used in the medical settings. You should be familiar with the color, the contents, and what they are called, especially their acronyms. So here on the screen, you can see is our plain NSS or our PNSS. It's 0.9% sodium chloride. It's basically an isotonic solution of water. It's used for replenishment of water loss in any case of dehydration. And if you want to replenish sodium levels in the body. Next, you have your D5LR. D5LR or dextrose, 5% dextrose in lactated ringers. It's used to replenish electrolytes lost in the body. Next is plain lactated ringers. It has a blue coloration as compared to our D5LR, which is pink. It's also used to replenish electrolytes in the body. Next, you have your D5NSS. So it's 5% dextrose in 0.9% sodium chloride. Next, you have your D5 water. It's color red. So here is the formula method of computing for our infusion rate. So our infusion rate is the rate in which we are adjusting our IV lines. So the infusion rate could be adjusted by the nurse or any medical professional for that matter to achieve a specific input of drug towards the body. So infusion rate is expressed in drops per minute because we can't adjust directly the volume, but we can adjust the drop rate. So we are adjusting the infusion rate or the drop rate. So here's the formula on the screen. Infusion rate equals volume of solution over time of infusion times drop factor. The volume of solution is expressed in ml. The time of infusion is usually in minutes. And the drop factor is a factor specific to each IV line. So each IV line would have a drop factor on the label or on the packaging. And this is specific per manufacturer per IV line. So you have to check every time for the drop factor. So the drop factor is a conversion between 1 ml and how many drops. So it's basically telling you how many drops would it take to form 1 ml. Okay, so let's have some sample problems. The physician ordered 500 ml of his special electrolyte solution to flow at 50 drops per minute. The pharmacy has called and asked how long will it take before the patient would need the next bottle. Administration set is 15 drops per ml. How long will it take for you to infuse the whole bottle? So what's being asked in this problem is time, because it's asking you how long will it take. So it's asking for time. So our formula is infusion rate, volume, time multiplied by drop factor. We already have the infusion rate, which is 50 drops per minute. We have our volume, which is 500 ml. We have our time, which is unknown, and our drop factor, which is 15 drops per ml. So let's rearrange the formula. So we have 150 minutes. Next. So the order is garamycin, 60 milligram IV piggyback for every 8 hours. What's available is Garacin, 80 milligram per 2 ml. And the administration set is 10 drops per ml. We have two questions. How many milliliters of garamycin do you need to prepare to equal the dosage ordered? And if you are to dilute the solution in NSS to make a final solution to 150 ml, what is the rate of infusion in drops per minute if the drug is to be administered within 1 hour? So let's answer the first question. The first question is asking how much of garamycin do we need to prepare. So what's available is 80 milligram per 2 ml, and what's prescribed is 60 milligrams. So we're going to use this concentration right here. So it's 80 milligram per 2 ml. So you need 1.5 ml of the available Garacin solution. So that's number one. It's that simple. Number one and number two aren't actually related questions, since the second one is asking you to dilute that 1.5 ml to 150 ml. So the final volume is still 150 ml, regardless of how much the initial volume was. So the final volume was 150 ml. The time is 1 hour or 60 minutes. The rate of infusion is unknown, but we know the drop rate, which is 10 drops per ml. ml will cancel out, so you have a final unit of drops per ml. So the infusion rate is 25 drops per minute. Next, a small child is given 10 ml of 3% lactated ringer solution, 50 ml of protein hydrolysate, and 10 ml of isotonic salt solution, using a micro dropper set which has a drop rate of 100 drops per ml at a rate of 50 drops per minute. What is the running time? So again, the question being asked is time. But the volume is broken up into 3 solutions. So it's 10, 10, and 50. That's a total of 70 ml over time, multiplied by drop factor, which is 100 drops per minute. And the infusion rate is 50 drops per minute. So let's have it. Drop per ml. ml per minute. So it's 140 minutes. Next, a patient suffering from acute asthma is prescribed 400 milligrams aminophylline to be administered 250 ml D5 water over an hour. If the administration set is 15 drops per ml, calculate the rate of flow. Aminophylline 50 milligrams per 25 ml is available. So in the question, it's to be added to 50 ml. So you need to compute how much volume of aminophylline should be added. So what's prescribed is 400 milligrams, and our concentration is 500 milligrams per 25 ml. So this is 20 ml. It's going to be added to D5 water, so that's 70 ml. We don't know the time again, but we do know the administration set is 15 drops per ml equals to, and the drop rate over an, oh sorry, so it's being asked the rate of flow, sorry, it's over an hour, over 1 hour, which is 60 minutes. So we're being asked the infusion rate, ml, so the final unit is drops per minute. $17.5. So the infusion rate is 17.5 drops per minute. The infusion rate. A doctor prescribes 250 ml normal saline solution at 32 drops per minute. The drop factor is 15 drops per ml. And the infusion rate is 32 drops per minute. So again, it's asking for time. What is the infusion time? $117.1875 minutes.